Welcome. In today's video, we are going to learn about a very important subject that has become a global issue. The statistics are staggering, and the growth is increasing life-limiting. In short, many lives are being affected by the minutes around the world. The morning of March 7, 2017, was a life-changing moment for me. I was whisked by an ambulance to a hospital bed, where the doctors did their part to save my life. It was like a miracle for me, and I am thankful to everyone who played a life-saving role on that very scary day of my life. After the fact, the whole thing took me by surprise. The last time I did all the craziest things was over 50 years back. I tried to eat healthily and live a clean life, but I ended up in a hospital bed. All my efforts to do the right thing, from living mindfully to a regular checkup at the doctor's office, didn't prevent the incident. After the surgery and having a stent in my heart, I still must depend on 4 friends prescribed by my doctor. My 4 friends are aspirin 81 milligrams, atorvastatin 80 milligrams, candesartan 4 milligrams, and bisoprolol 2.5 milligrams. If it weren't for my workplace colleagues and management, the ambulance, and the doctors, the whole medical system, I wouldn't have lived to tell my story 7 years later. For that, I am eternally thankful and feel indebted to do my part by promoting the cause and bringing awareness to others. I may not be a medical professional, but I am trying to learn more about the subject matter and hope my effort is not in vain. The human heart, from a spiritual perspective, 1, is revered as a symbol of life and love across cultures and religions. 2, it represents the seat of emotions, compassion, and connection beyond physicality. 3, it is seen as a center for spiritual awareness, intuition, and divine essence in various belief systems. From a medical perspective, 1, it is a vital organ responsible for pumping oxygenated blood throughout the body. 2, it functions ceaselessly, supporting the body's circulation and delivering nutrients. 3, it is essential in maintaining life, regulated by a complex electrical system and physiological processes. In this video, we are going to delve into cardiovascular disease, give you an insight into the subject, and encourage you to learn more to stay informed and take care of yourself and your loved ones. After all, we all are the keepers of our brothers and sisters alike. Cardiovascular diseases CVDs, June 11, 2021. Key facts. 1. Cardiovascular diseases CVDs are the leading cause of death globally. 2. An estimated 17.9 million people died from CVDs in 2019, representing 32% of all global deaths. Of these deaths, 85% were due to heart attack and stroke. 3. Over 3/4 of CVD deaths take place in low and middle income countries. 4. Out of the 17 million premature deaths under the age of 70 due to non-communicable diseases in 2019, 38% were caused by CVDs. 5. Most cardiovascular diseases can be prevented by addressing behavioral risk factors such as tobacco use, unhealthy diet and obesity, physical inactivity, and harmful use of alcohol. 6. It is essential to detect cardiovascular disease as early as possible so that management with counseling and medicines can begin. What are cardiovascular diseases? Cardiovascular diseases CVDs are a group of disorders of the heart and blood vessels. They include 1. Coronary heart disease, a disease of the blood vessels supplying the heart muscle. 2. Cerebrovascular disease, a disease of the blood vessels supplying the brain. 3. Peripheral arterial disease, a disease of blood vessels supplying the arms and legs. 4. Rheumatic heart disease, damage to the heart muscle and heart valves from rheumatic fever caused by streptococcal bacteria. 5. Congenital heart disease, birth defects that affect the normal development and functioning of the heart, caused by malformations of the heart structure from birth. And 6. Deep vein thrombosis and pulmonary embolism, blood clots in the leg veins, which can dislodge and move to the heart and lungs. Heart attacks and strokes are usually acute events and are mainly caused by a blockage that prevents blood from flowing to the heart or brain. The most common reason for this is a buildup of fatty deposits on the inner walls of the blood vessels that supply the heart or brain. Strokes can be caused by bleeding from a blood vessel in the brain or from blood clots. What are the risk factors for cardiovascular disease? The most important behavioral risk factors of heart disease and stroke are unhealthy diet, physical inactivity, tobacco use, and harmful use of alcohol. The effects of behavioral risk factors may show up in individuals as raised blood pressure, raised blood glucose, raised blood lipids, and overweight and obesity. These intermediate risk factors can be measured in primary care facilities and indicate an increased risk of heart attack, stroke, heart failure, and other complications. Cessation of tobacco use, reduction of salt in the diet, eating more fruit and vegetables, regular physical activity, and avoiding harmful use of alcohol have been shown to reduce the risk of cardiovascular disease. Health policies that create conducive environments for making healthy choices affordable and available are essential for motivating people to adopt and sustain healthy behaviors. There are also several underlying determinants of CVDS. These reflect the major forces driving social, economic, and cultural change: globalization, urbanization, and population aging. Other determinants of CVDS include poverty, stress, and hereditary factors. In addition, drug treatment of hypertension, diabetes, and high blood lipids is necessary to reduce cardiovascular risk and prevent heart attacks and strokes among people with these conditions. What are the common symptoms of cardiovascular diseases? Symptoms of heart attacks and strokes. Often, there are no symptoms of the underlying disease of the blood vessels. A heart attack or stroke may be the first sign of underlying disease. Symptoms of a heart attack include 1. Pain or discomfort in the center of the chest and/or 2. Pain or discomfort in the arms, the left shoulder, elbows, jaw, or back. In addition, the person may have trouble in breathing or shortness of breath, nausea or vomiting, lightheadedness or faintness, a cold sweat, and turning pale. Women are more likely than men to have shortness of breath, nausea, vomiting, and back or jaw pain. The most common symptom of a stroke is sudden weakness of the face, arm, or leg, most often on one side of the body. Other symptoms include sudden onset of numbness of the face, arm, or leg, especially on one side of the body, confusion, difficulty speaking or understanding speech, difficulty seeing with one or both eyes, difficulty walking, dizziness and/or loss of balance or coordination, severe headache with no known cause, and/or fainting or unconsciousness. People experiencing these symptoms should seek medical care immediately. What is rheumatic heart disease? Rheumatic heart disease is caused by damage to the heart valves and heart muscle from the inflammation and scarring caused by rheumatic fever. Rheumatic fever is caused by an abnormal response of the body to infection with streptococcal bacteria, which usually begins as a sore throat or tonsillitis in children. Rheumatic fever mainly affects children in developing countries, especially where poverty is widespread. Globally, about 2% of deaths from cardiovascular diseases are related to rheumatic heart disease. Symptoms of rheumatic heart disease 1. Symptoms of rheumatic heart disease include shortness of breath, fatigue, irregular heartbeats, chest pain, and fainting. 2. Symptoms of rheumatic fever include fever, pain and swelling of the joints, nausea, stomach cramps, and vomiting. Why are cardiovascular diseases a development issue in low and middle-income countries? At least 3/4 of the world's deaths from CVDs occur in low and middle-income countries. People living in low and middle-income countries often do not have the benefit of primary health care programs for early detection and treatment of people with risk factors for CVDs. People in low and middle-income countries who suffer from CVDs and other non-communicable diseases have less access to adequate and equitable healthcare services, which respond to their needs. As a result, for many people in these countries, detection is often late in the course of the disease, and people die at a younger age from CVDs and other non-communicable diseases, often in their most productive years. The poorest people in low and middle-income countries are most affected. At the household level, evidence is emerging that CVDs and other non-communicable diseases contribute to poverty. Due to catastrophic health spending and high out-of-pocket expenditure. At the macroeconomic level, CVDs place a heavy burden on the economies of low and middle-income countries. How can the burden of cardiovascular diseases be reduced? The key to cardiovascular disease reduction lies in the inclusion of cardiovascular disease management interventions in universal health coverage packages. Although in a high number of countries health systems require significant investment and reorientation to effectively manage CVDs, evidence from 18 countries has shown that hypertension programs can be implemented efficiently and cost-effectively at the primary care level, which will ultimately result in reduced coronary heart disease and stroke. Patients with cardiovascular disease should have access to appropriate technology and medication. Essential medicines that should be available include aspirin, beta blockers, angiotensin-converting enzyme inhibitors, and statins. An acute event such as a heart attack or stroke should be promptly managed. Sometimes surgical operations are required to treat CVDs. They include 1. Coronary artery bypass. 2. Balloon angioplasty, where a small balloon-like device is threaded through an artery to open the blockage. Valve repair and replacement. Heart transplantation and artificial heart operations. Medical devices are required to treat some CVDs. Such devices include pacemakers, prosthetic valves, and patches for closing holes in the heart. WHO response in 2013, WHO member states agreed on global mechanisms to reduce the avoidable NCD burden, including a global action plan for the prevention and control of NCDs 2013 to 2020. This plan aims to reduce the number of premature deaths from NCDs by 25% by 2025 through 9 voluntary global targets. 2 of the targets directly focus on preventing and controlling CVDs. Target 6. Reduce global prevalence of raised blood pressure by 25% between 2010 and 2025. Target 8. At least 50% of eligible people should receive drug therapy and counseling including glycemic control to prevent heart attacks and strokes by 2025. In addition, Target 9 states that there should be 80% availability of the affordable basic technologies and essential medicines, including generics required to treat major NCDs in both public and private facilities. Achieving these targets will require significant investment in and strengthening of health systems. WHO is currently working on increasing the normative guidance available for the management of acute coronary syndrome and stroke, which will provide guidance in these critical areas. Thanks for watching, and if you enjoyed it, please don't forget to share, like, and subscribe for more.